Dr. Fong, you told me that you have a machine called a CEREC machine, which basically makes a person's crown right there in the visit. So there's no major, sending to the lab, come back. It's done right then. Tell me about the advantages about this thing.
Well, this revolutionary technology and equipment that we have allows us to be able to provide exceptional service to our patients. It's very convenient and comfortable, in which we're able to take the traditional 2 or 3 multiple visits and be able to consolidate it into one single visit, in which we're able to restore a badly deteriorated or damaged tooth, and then be able to provide a restoration that fits on the tooth in that one visit. So that means no additional shots, no uncomfortable temporary and sensitivity. We start the procedure and complete it in one visit.
Wow. So, and the crown then is same than any other crown. It's have the color you want, the shape you want, and all that type of stuff. And
yes, with this technology,
and the strength that it doesn't break, or maybe it's even stronger. I don't know what's the deal there.
Well, the material that we use in providing this restoration is a ceramic material, and so therefore it will match the coloration of your tooth, giving it a more natural appearance, and it's very durable, just like tooth enamel.
Okay, good. Wonderful. And obviously you can do any color, any shape the patient wants on each.
Yes, we can customize it to the color of their natural teeth.
Wonderful. So it's instant, bang, bang, bang. Well, let me ask you, is that a good thing for, I heard about instant implants, which may be a whole different ballgame in itself.
Yes.
Can you elaborate on that? And would doing the crown instantaneously, would that help out for a real instant implant, or what's the story there?
Would you repeat your question, Helmut?
Well, I heard about a thing called an instant implant.
Okay.
Number one, what do you feel about that? Where you basically you put the titanium, little screw, I call it, in it. And the same time, same day, you put the crown on it. And since you just talked now about having able to make a crown instantaneously with the CEREC machine, how would that fit in? And how do you feel? And what do you think about this instant implant in the first place? So let's go to that first.
Well, what I wanted to do is that the instant implant is a totally separate entity from maybe the way that we would restore a tooth instantly, because to give you an idea, with restoring a tooth, it's simply where we're able to prepare and remove the decay and damage on the tooth there and modify the surface of it. Then we need to take a camera to image it, and the camera we use is like a Blu-ray DVD player. And once we're able to receive that optical image, then we can go ahead and design the crown, send that information to a milling unit in our office, and then from there, from a ceramic block, it mills away the excess material to the form and shape of the crown that would fit on your tooth. Then from there, we use the most advanced adhesive dentistry to bond that restoration onto the tooth and make it more stronger. On the other hand, with instant implants, that requires the placement of a titanium component that's implanted or embedded into the jawbone. But what takes time is that we need to allow for the bone to integrate with the metal implant. And so there's a difference between allowing the body, which takes time to do its part, which is to allow for good anchorage of the metal implant, versus restoring the tooth directly with using CEREC technology.
Okay. So obviously, two different things. But
yes, it is.
We did talk about instant implants. So you said that the metal which you put in, or the bone needs to integrate. You don't want to right away put that crown on it, so because it becomes, maybe it doesn't we can walk. It needs to set. Like when you build
it
a
adds
house,
stress. Yeah, it adds stress to the jaw.
You
Yes.
put the cement, you put some balls in it, but you want to leave them there for a few days or whatever it is for them to settle, for the cement to get hard. Same here. The screw needs to grow into the bone naturally. So would you say that overall instant implant is, because you hear it advertised, would you overall say that one got to be very careful with instant implant because one could be bargaining for problems down the road because the implant never really settled in the first place?
Well, instant implants, I think in our culture and society today, we do want things instantaneously, and so it truly is appealing. I think the best thing to do is an individual should seek the advice of the healthcare professional and to see what is more suitable for their particular conditions. So bottom line is that it does require evaluation and discussion with the dentist, and then from there, both the dentist and you can develop a team approach in ensuring that you get the best treatment possible.
Right. So there may be sometimes a situation where an instant implant might be possible, but then again, it quite often not, and the dentist would probably evaluate that of like if it is possible. Now let me ask you, if you don't get an instant like crown put on, meaning you wait till this titanium thing, will you have a big hole in your mouth, or will there be going something temporarily on there which actually makes you looking acceptable in on the street of Los Angeles?
Yes, we would. That is true. It would be important. So a temporary, or what we call a provisional type of crown, would be placed on there, and so that when you're chewing and biting on it, you wouldn't be adding any stress to the implant. So it would fill in that black hole or space in your mouth there, but it doesn't add to any stress to the jawbone while we are waiting for the implant to integrate with the bone.
Good. Well, in any case, even dentistry technology is advancing, and as you rightly said, we're living in an instant world. So now we can have instant orthodontics, and we can have our crowns right away, and it's all a bang bang, come in and go out. My wife probably would tell me, Helmut, why don't you go for an instant change of head or something like that? All right, beautiful, wonderful. Thank you.